But I want to follow up to a little bit of what Dr. Vincent talked about on person-centered care and trauma. The numbers are horrifying. 92% of all the women in jail and prison in the United States with serious mental illnesses have horrific histories of trauma, mostly sexual abuse. And it doesn't happen when they're adults. It usually happens when they're quite young children. And quite frankly, they are victims. And we never addressed it early on. And we allowed them to grow up into a criminal justice system that is quite harsh, quite mean, and quite ugly. And not only does nothing to address their trauma and mental health issues, we actually make it much worse by re-traumatizing them in this system. 75% of men who are in the criminal justice system with serious mental illnesses also have horrific histories of trauma. Sometimes it's sexual abuse, but more likely they have been victims of long-term domestic violence, or they have been witnesses to very serious violent crimes. And a young brain that is exposed to these kinds of trauma is damaged even more than an adult brain. But they're seeing what a soldier sees in combat. And we know today that the reaction in the brain is not emotional, so you can't shake it off. It's truly a physiological reaction in the brain that is permanently altering brain activity. And so by not treating it at an early stage, which is what we should be doing, again, we allow these poor kids to grow up into our system. And then we blame them when they fail. And so this talks about professionals involved with serious mental illness and patient care. I think it is more aspirational than real because it doesn't exist. It's a great slide of what it should be, but unless it is forced to happen, it does not exist in our communities. In fact, I think we're way overly generous when we call it a system at all. It is a hodgepodge of under-resourced, understaffed, not even always using evidence-based practices that are struggling to meet the needs of a population that they were never designed to treat. So yes, it would be nice to have a patient in the center for center-cared treatment, but the reality is I'm going to see them first before any of you are. And I think our great hope today is that you get as mad as hell as we are and stop accepting it, because it just doesn't have to be this way.